Thank you for joining us for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. We're hosting a press briefing today to discuss the importance of connection and safety during this holiday season. We have great panelists today to discuss the importance of relationships, and we will receive an update on our medical situation. Hopefully, we're waiting for one of our panelists. We've invited Dr. Dan Suler, family medicine physician and vice president of medical affairs from Grand Itasca Clinic and Hospital, Kim Geislinger, mental health practitioner from Ross Resources, Patrick Lovejoy, pastor, First Evangelical Lutheran Church in Grand Rapids, and Jessica Setness, resident of Deer River. As we're coming toward the end of this 2-year global pandemic and moving into year 3, we really want to honor the sacrifices that all of you have made. And that includes not gathering in person with your friends and family. At this point, COVID is something we are all learning to live with, but we're honoring the fact that for many of us, if we contract this virus, it will be incredibly serious. It has taken 103 of our Itasca neighbors already, and 32 of those have just been since September 12th, and that's less than 3 months ago. At this time last year, we hadn't lost that many Itascans after 9 months of this virus arriving in our county. Last year at this time, we did have a drop in our case rates, but at that time we had much more mitigation in place. We were masking, we were closing down some businesses where there tended to be more gatherings. And this year, we need to keep each other safe ourselves. It is up to us to make our own decisions, especially over the holidays when we know we have the need to connect with our loved ones in some manner. Some things we can do. We can get our vaccine series started right now to begin building the antibodies to COVID. And if you've already completed your series and it's been 6 months from your either Pfizer or Moderna, or it's been 2 months since your Johnson & Johnson, get your booster now. Again, that's to allow at least 2 weeks to build up additional antibodies prior to the holiday. And if you haven't received your flu shot, you can get that now too. This vaccine also requires some time to build up immunities. And just so everyone knows, we have identified influenza in Itasca County already this year, and we've already identified it in Minnesota this season. Other things you can do, consider quarantining. You may remember last year, lay low before you go. That was our message last year. Keep yourself safe before you travel or before you visit your family. Keep yourself healthy with good hand washing and sanitizing. Get enough sleep, eat fruits and vegetables, move your body daily. If you do gather over the holidays, allow enough space to stay 6 feet apart from others and assure adequate ventilation. And outdoor air is great for that, with windows or doors open to allow for the air circulation. Another thing you can do, you can test before you gather. You can purchase test kits, rapid test kits online via some of the pharmacies such as Walgreens or CVS or Walmart. On the Minnesota Department of Health website under testing, you can access one of the free state testing sites, or you can order a Vault saliva test, and that is free to residents of Minnesota. And so you can test prior to seeing your family over the holidays to make sure you are able to share the gift of connection, not COVID or flu on Christmas. We are going into Christmas with a 14-day case rate of 97.6. We've been as high as 143 this past month. We've been down to 92, back up to 100, and again, we're at 97.6. And the message here is that COVID is very prevalent in Itasca County. Our numbers are continuing to fluctuate. Just yesterday, we had 40 new positive cases come through, that one day alone. So we do need to make our own decisions to keep each other safe going into this holiday. I will now introduce Dr. Dan Suler. Is he on? If not, we will actually come back to him.
There he is.
Oh, there he is. Thanks. Dr. Suler, family medicine physician, vice president of medical affairs from Grand Itasca Clinic and Hospital.
Good morning. Sorry, we have some technical difficulty here. Can you hear me okay?
Yes, you sound great.
All right, I'll get going. So thanks for having me with the crew this morning. So I just want to take a few minutes to update our local community on what our current situation looks like with regards to providing medical care during this most recent surge. So locally, this surge has impacted us more than any previous surge we've seen. For the past 2 months, for example, we have had approximately half of our hospitalized patients with COVID in our hospital. We continue to care for patients that we typically would not care for at Grande Itasca. This includes caring for much sicker patients that previously would be transferred to a larger facility with more specialized equipment and personnel. While we can provide this type of care, it is difficult for our smaller facilities to do this day in and day out, as our resources are quite limited. We continue to care for patients that typically would be cared for in an ICU or regular hospital bed in our emergency department for days on end. This is just simply not normal. Because of this, our emergency department, which has 10 patient rooms, has had days where we're trying to keep up with normal volume with just 2 or 3 rooms because the rest are being filled with patients waiting for hospital rooms. This slows down how quickly we can see our typical emergency room volume. Unfortunately, this has led to some of our patients actually getting frustrated and leaving, which again, just further complicates their medical care down the road when they finally do need to come in. This, of course, is not ideal and continues to contribute to our overall community's decline in health. Locally, we've made adjustments in other aspects of our facility, including limiting or postponing surgical procedures, such as joint replacements, so we have more staff and beds available to care for medical patients. We're also limiting wellness exams, such as well child checks and annual physicals, so our clinic staff can help absorb patients that would otherwise normally be seen in the emergency department. Again, this is not normal, but we're doing what we have to do. As you can see from these changes, we and other medical facilities are currently putting into practice. The surge is very much real and impacting healthcare in our area. Because of these struggles, we continue to ask the public to do all they can to prevent what is now often seen as unnecessary hospitalizations due to COVID. While there are breakthrough infections that require hospitalizations, this is a very rare experience. We ask that you continue to stay home when you are sick, get tested if you have symptoms or exposed to COVID, and wear masks when appropriate. Vaccines continue to be the most effective way of minimizing infections, hospitalizations, and death. I've said this before, and I'll say it again. There is not much in medicine we do that is more effective than vaccinations. This current variant is no different. With the emergence of this new variant known as Omicron, there's much we are learning every day. What we do know is this: vaccines appear to be effective, especially once a booster is completed. Prior infection with COVID alone does not appear to be an effective method of preventing reinfection anymore. If you have been relying on prior infection to protect you from reinfection, I ask that you reconsider this and get vaccinated. Omicron appears to be spread much easier than previous variants. This makes it much more likely that those in close proximity will spread easier. I urge all those with children at home, 5 and older, to start their vaccination process to minimize spread at school and with activities. I thank those parents that have already started that process to keep their kids safe. To those that have received their initial vaccine series, please get your booster. Early studies suggest that there is a large difference in those that have been boosted and those that have not when it comes to the new variant. Finally, I just want to end with a message of thanks. Please believe me when I say this, no one wants this pandemic to go away more than medical professionals, including myself. I look forward to coming to work someday soon and shaking my patients' hands once again, seeing their smiles and not having to wear a mask. I thank those of you that have done what you can do to help keep our communities healthy. I'll turn it back to you, Kelly. Thank you.
Thank you, Dr. Suhler. And we will now hear from Kim Geislinger, mental health practitioner, Ross Resources.
Thank you, Kelly, and thank you, Dr. Suhler, too. Hats off to all of you in the medical field. It's been a long 2 years, but we so appreciate you and see the good that you're doing. I was asked to talk a little bit about the power of relationships during this time, and with my work in community with our school districts in our truancy prevention programming, as well as our prevention grants that really have brought about a big surge in the science of the positive in our communities. I think we need to really take time too to reflect on the fact that connections are also is going to be the issue that's going to get us through some of these tough times. We realize how important connections are. For kids especially, being back in person in school has been an amazing gift to our kids in community, and I think to parents, because it was very difficult to have everybody at home. We have really seen an increase in anxiety and depression with a lot of our kids, and just struggles because of that unstructured time that they've had. We know that kids who are connected to caring, competent adults really have such great, bright futures ahead of them. It is such a great protective factor. And I think we also know as parents, when we raise our own kids, that's usually not us, especially for a teenage child. And so having that connection with school teachers, coaches, community providers, faith providers, that is so important for raising good, healthy kids. And when we've not been able to do that in a face-to-face setting, that's just been a concern. So I'm super thankful that people are taking steps to make sure we can keep kids in school, that we as community members can be out and again engage in some community activities together. There's just nothing like face-to-face connection. With that, we're always balancing that hope and concern in our communities. And I think concerning has been the addition of screen time and connection that kids have made, maybe in some social media things that are more concerning to us than positive. And so we as adults really have an opportunity to just connect with kids and really ask them how things are going. That doesn't cost us anything, but it can really make the difference for somebody who is just struggling. Our attention has really become a commodity in this world, and we know that we are scrolling at the same time we're having conversations and we're trying to book our next appointment, and our brain isn't supposed to work that way. And so I appreciated your comments, Kelly, about getting outside, because just even being outside to take a short break in nature is kind of a perfect balance of visual and silence for our brain. And I think we have a real concern with kids with how they are unable to keep silent or still for some time. And so we really, I hope as a community can increase that and talk about that. And I know the schools are doing a good job of that with their social emotional learning curriculum. We just need to get back to that connection. And so I applaud our community for all the things that we're doing, even our stakeholder meetings on a regular basis, just trying to keep community connected, because we do know how important it is.
Thank you, Kim. And we will hear from Patrick Lovejoy, pastor of First Evangelical Lutheran Church in Grand Rapids.
Well, good morning, and thank you again for the invitation. And I think Kim really did a great job of summarizing just the importance of the community and that face-to-face connection, and it really builds up to this discussion of this desire and wanting to get together, whether it's in we practice our faith as we gather together in worship, or as we come together in our homes. I think Kelly talking about the importance of being able to do it responsibly and being able to do it respectfully, I think is probably the most important thing as we move forward. When I continue to visit with individuals, there's so much fear that continues to surround a lot of individuals as they go about their daily lives and as they continue to relate to one another. So one of the big things that I want to just continue to remind everybody is that this virus and this pandemic is not one of where we're against one another, but continue to see each other as we have as family members and members of our community and neighbors, that we're all working together collaboratively to overcome these obstacles that we've been dealing with now, like you said, for over 2 years, and to keep that in mind, because especially this time of the year, we have a rise in stress, and oftentimes that erupts in our families, and we see added crisis or strife that happens in relationships, continuing to recenter ourselves and remind ourselves who we are to one another and how important our connections are extremely valuable. So again, just to reiterate some of the things that Kim already said, but as we do go out and as we do gather, to see it as a way of serving one another, I always continue to tell people it's not about what we can do, but what we should be doing as we protect one another and as we are responsible for keeping each other healthy and safe. I know that there's a lot of times people talk about the severity of the virus or any number of different things. The reality of it is none of us want to be sick. So let's just continue to be good stewards of our opportunities and the relationships that we have, and continue to do this in a way that's healthy and promotes health and continues to provide safe environments so that we can continue to celebrate in weeks and months and years to come. So I just wanted to reiterate that, continue to talk about the importance of gathering together and to do it in a respectful way. I know that oftentimes things get a little heated and politicized from time to time, but again, remembering that this isn't about politics and it's not about even seeing people as the problem, but continuing to rally together, even though that we're all pretty much fatigued by a lot of these things so far. So I'll turn it back to Kelly, and if there's any questions, I'll be happy to answer them or address them later. So.
Thank you. And we'll now hear from Jessica Setness, resident of Deer River.
Thank you, Kelly. And thank you everyone for your words of connection. It really is important. And as Kelly said, I'm a Deer River resident, but much of my family lives in the metro area. And so COVID took away our opportunities to connect with our extended families. But now we've reached a point where if we take the right precautions, we can safely see our loved ones again. So over the Thanksgiving holiday, I was able to see family that I haven't visited in almost 2 years. We have an aunt with a lung condition and other family members with some underlying health conditions. And of course, we've got little ones who are too young to be vaccinated. And it would absolutely break my heart if I were the cause of them getting sick. So while we recognize that it's important that we retain our connections with family, it's really important that we keep them safe. So what we did, we took extra precautions. My husband and I already wear our masks at work and in the community. We're both vaccinated and we've gotten our boosters. So prior to Thanksgiving, we limited our exposure to others. And then while we were on our way down, we took rapid tests before coming into contact with any of our families so that we knew we wouldn't pass anything on to them. And I really urge everyone to do the same this holiday season. As Kelly said, the last gift you want to give anyone is COVID-19. Thank you.
Thank you, Jess. And we will now ask our media attendees if they have any questions to identify themselves and their organization in the chat, and we will ask our panelists to respond. We have Kathy from KOZY Radio. I still see a lot of cloth masks being worn in the community. Are they as safe as disposable masks? I'm going to ask Dr. Suler to weigh in on that.
Yeah, so ideally the disposable masks would be worn. Cloth masks are better than nothing though. So we'll take any mask, and there's definitely a hierarchy. And if you can get your hands on some cloth masks like we wear in the clinic and hospital, that would be the ideal. And of course, N95 is a higher level. They work pretty well, but you have to be fit for them properly for you to get the benefit of using an N95. So short answer, cloth is better than nothing. Disposable paper mask would be ideal.
Thank you. Other questions from our media partners? I am seeing none, but I do want to remind our community members, oh, we do have another one coming through. Kathy Kaozi, why? Holiday stress is nearing an apex. How can people re-stress safely? Patrick or Kim, do you want to take that? De-stress, not re-stress.
Well,
Go ahead.
one thing I thought of when Patrick was talking was really that, our mind naturally is kind of drawn to the negative or the wow factor of the news, which many times can be negative. So it's important for us, especially now, to be intentional about gratitude and just trying to tune into that. And really, we do have to train our brain to do that, to see the good. And I think a lot of our community has learned a lot about that in our recent work in the last 10 years in our community with our grants. But it is a difficult process to balance that hope and concern. And you can hear a negative report, cases rising, but on the bright side, more people may be getting vaccinated. We really need to flip that script and to be intentional, and that can just bring less stress to people. And again, connect with people that are good to be connected with. We really want to surround ourselves with people that are going to help us be the best version of us.
And I would just add to what she's saying, that's absolutely true. And also being able to separate ourselves from a lot of the noise that's out there, spending time with, being mindful of ourselves and checking in with ourselves periodically, how we're doing emotionally, and then being able to be intentional with addressing some of those needs, being honest with where we might be emotionally or mentally, and what we can do to better ourselves. A lot of times when we talk about mental health, it's taken for granted by a lot of individuals, thinking it's one of the things that will just take care of itself, but it's one of the things that we actively need to be involved in and cultivating. And so taking time periodically throughout the days to just check in, see how you're doing. And then like what Kim was saying, being able to surround ourselves in an environment that helps us either de-stress and also builds up what we want in our life. And I think that's one of the great things about now, as we've been working so hard, trying to make sure that at least in our faith communities and in our churches, being able to provide these safe environments for people to come together to start having some of that part of their life back. It's a great way of being peaceful and being in the moment and cultivating a healthy mindset. So.
Thank you. Other questions from our media? Okay, if not, I do want to remind you, we honor the relationships, we honor the sacrifices, but we also honor the fact that COVID-19 is serious. And for some of us, it will not affect us very well. We've seen that with our Itasca neighbors, and we're so sorry that we've lost some and some are suffering and what this has done to families. And we've heard from one of our residents how you can be together safely. Get outside if you can, get vaccinated, get boosted, do it this week. Give yourself a couple weeks before Christmas, wear a mask when appropriate. Consider testing before you gather with anybody else. You don't want to give the gift of COVID or influenza when you're connecting with others. Thank you.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.